Naturalhealthcare.ca, Canada's guide to complementary and alternative healthcare. Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Today, we're going to talk about yeast infections. But before we get to that, we're going to see what JJ is taking today.
Okay, today I'm taking a probiotic. It's a mix of, in this case, it's a mix of lactobacillus, that's a form of healthy probiotic, bifidobacterium, which is another form of probiotic, and it's in this handy dandy little pill. It's a little bit on the green side because they put in some greens. Je ne sais pas pourquoi, but they do. That's, I don't know why in French. And it's great. So a very common treatment I use for people with yeast infections, which we'll talk about in a little bit.
Perfect. And you can actually find probiotics in yogurt and in unpasteurized sauerkraut too.
That's true. Yeah, you could find it in a lot of fermented foods. Yeah, definitely, most definitely.
Awesome. So let's get into what is a yeast infection.
Okay, yeast infection in women is often they'll come in with a vaginal yeast infection. That's a pretty common complaint I'll see women coming in at some point in their life. They will end up with a yeast infection. Some of it comes from their immune system being a bit compromised, a bit stressed. Often what we'll find in some women is they may actually be getting it from their partner. I've had a few cases of that where we've had women that have come in with yeast infections, we've treated them, and it keeps coming back, and eventually we test the man, and we found, oh, actually the man had it, but he didn't have any symptoms. Also there's another diagnosis of yeast infection. It's a whole body yeast infection, which I don't subscribe to. It's called Candida. Often I'll see patients will come in and they'll tell me, oh, I have Candida. And I'll look at them and I'll go, what do you mean by Candida? So usually it's a group of symptoms that are pretty general that people all just blame on Candida, on yeast in general. I don't subscribe to that. I think really their symptoms are more due to digestive problems and not having a well-balanced gastrointestinal flora.
And that's the key thing, is keeping it in balance. And so if you take something like an antibiotic, that throws it all out of whack.
It does. So when my patients go on antibiotics, and in many cases we need to take antibiotics. Listen, if I have something that's pretty hard-hitting infection-wise, I would want to take an antibiotic. But what you have to do is you have to repair some of the damage done by the antibiotic. So whenever I take an antibiotic, I'd wait about 3 or 4 hours, and then I would take a probiotic after. You don't take them together because your antibiotic is just going to kill your probiotic. There's no point. So I just take them apart, and then when you're done your course of antibiotics, you always want to make sure you go the full course of the antibiotics. Then I'll have people do a probiotic sometimes for a month.
So what are some common symptoms of a yeast infection?
Well, in the case of women, usually it would be vaginal discharge, itchiness, pain on sexual intercourse. What's usually triggered people to come and look at gastrointestinal, so Candida, basically it's a gastrointestinal imbalance, would be symptoms such as gas or bloating, a little bit of itchiness around the anus. That's when people think, maybe something's going on. So those are some of the common symptoms you'll see.
And in babies, another one is orally thrush.
Oral thrush, that's true. You also see that in HIV patients. They'll have oral thrush. Cancer patients I've seen with oral thrush because their immune system's compromised when they go under chemotherapy. So you will see that too. Yeah.
Now you said that it can be passed back from your partner. So what are some signs of Candida, yeast infection in men?
Men, they're often asymptomatic.
Really? Jock itch or anything like that? That's not...
Yeah, jock itch is fungal, but it doesn't work like that. It wouldn't be that one. It wouldn't be that one which is passing the infection.
So they can go on and not even realize it.
Yeah. For the most part, the men aren't aware that they have symptoms.
So how do you diagnose a yeast infection?
In the case of women, what you do is you do a vaginal smear. And they'll smear it on a slide and they'll see yeast cells and they'll say, oh, wow, you have a lot of yeast cells. In the case of a man, what they'll do is they'll usually they'll culture a discharge, so urethral, some form of seminal fluid discharge, and they'll find it that way.
Yeah, I know you don't agree with this, I was diagnosed with Candida from an
Yep.
oral swab from my holistic dentist.
Mm-hmm,
And she found that there was an imbalance in the bacteria, so I did a Candida protocol.
Well, really, what you have is you have an imbalance in your bacteria, in the microflora in your mouth and in your digestive tract. So it's not, you don't really want to call the whole complex Candida. It's really your body's out of balance. Your bacteria, your healthy bugs are out of balance. So that really should be your diagnosis. You don't want to go and blame it on Candida, because there is naturally, Candida occurs in all of us.
Yes.
But it's when the levels get too high, and it's not just Candida that's the culprit.
Okay. So how do you treat a yeast infection?
Probiotics. That's one of the best things to do is probiotics. We'll give it orally. There's been a lot of good studies for even in pregnant women. We've seen where women have been taking probiotics orally. They help to prevent bacterial vaginosis. And also you could give it vaginally as suppositories. So when women come to me with chronic yeast infections, we'll usually do a course of about a week of suppositories. Then they'll go on for a month, 2 months orally, and eventually we rebuild their terrain, and they're a lot better.
What about diet? Are there things that people should avoid?
There's the Candida diet, which I think is too extreme. I tend to stay away from that. I'll usually put them on a good detox. We've done a detox episode in the past, so please have a look at that. But on the detox diet, you're avoiding refined sugars, you're avoiding wheat and dairy and alcohol just on the short term to kind of take a break from that. A lot of the opportunistic pathogens tend to like a lot of sugar. But some of the Candida diets out there are too severe. And I found patients that have become so sensitive that when you try to reintroduce a normal diet, they get flare-ups. So I'm not a big fan of the Candida diet, because the Candida diet is nothing fermented. So you can't have bread, you can't even have sauerkraut, you can't have yogurt. It's just, I think it's a bit too,
no vinegar, no fruits,
vinegar.
Very limited fruits, sour apples, grapefruit, lemon. And it was very limiting, and it was very hard to do. And I also had to take bentonite and caproic acid. So.
Yeah, they try to kill it off. I don't usually go after, if it's a parasite, I'll kill it off, which is a completely different issue. But if it's a bowel imbalance, you just give the colonizers, the probiotics that'll rebalance the bowel. So you don't have to go and give something to kill it off, or you don't have to try to starve it like they do with the Candida diet. And also, too, probiotics act a little bit as an antibiotic, because a healthy probiotic, for example, a lactobacillus, secretes lactic acid, which they use to kill off other bacteria. Also, other probiotics have things called bactericides, which act as antibiotics. They're basically designed to kill off other bacteria. So they kill off, sort of a la antibiotic, but they colonize with healthy ones.
So how long would somebody take on this approach?
Depends.
Depends on how severe the case is.
Yeah.
And then once you clear it up, is it gone for good?
It depends. Stress will will throw your flora off. If you smoke, if you have poor diet habits, if you travel to a foreign country and you get a parasite, there's a number of things. But if you're predisposed to it, in many cases we fix you and you're fine, and you may have to go on and off probiotics just to rebalance. It depends. Depends how many courses of antibiotics you've had in your life. Depends your overall health too.
Very interesting. So you should really work with a healthcare practitioner to take a look at your whole health and design a plan that's right for you and see what you have. And if you would like to find a naturopath in your community, you can click on the Find a Practitioner link on our website, www.vitaminjunkies.com. And while you're there, you can join the addiction.
Join the addiction.
And when you subscribe to Vitamin Junkies, you will receive notification of every new episode, so you won't miss a single episode with me and JJ. Thank you for joining us. And one more thing, I have a request of you. We'd like to get to know you. So if you could please take a look at the show notes on our website, click on the survey, and we'd like to find out a little bit more about you. It will be a very short survey, and it gives us an opportunity to know what your interests are and what we can do for future episodes of Vitamin Junkies. Thanks for joining us. I'm Jennifer Lyle.
I'm Dr. JJ.
And continue the addiction to good health.
Do